Have you ever wondered what happens after a major medical procedure, especially one that deeply impacts your body's ability to heal itself? Today, we are going to explore the recovery timeline for something very specific and incredibly important: your blood counts after a stem cell transplant. After a stem cell transplant, your blood counts, including white blood cells, red blood cells, and platelets, typically begin to recover, a process called engraftment, within about 2 to 4 weeks. This initial period is critical as your new stem cells start to produce healthy blood cells, rebuilding your immune system. The reason for this specific timeline lies in the biology of stem cells and the conditioning regimen you receive before the transplant. High-dose chemotherapy or radiation therapy is given to eliminate existing diseased cells and create space in your bone marrow. The transplanted stem cells then need time to travel to the bone marrow, settle in, and begin multiplying and maturing into different types of blood cells. The speed of this process depends on factors like the type of transplant, the number of stem cells infused, and the overall health of the recipient. To help support this recovery, your healthcare team will monitor your progress closely with frequent blood tests. You will likely receive transfusions of red blood cells or platelets as needed to manage low counts, and growth factors might be administered to stimulate white blood cell production. It is crucial to follow all medical advice regarding hygiene, diet, and activity restrictions during this time to prevent infections and complications, as your immune system is still very vulnerable. This initial recovery, while crucial, is just the first step. Full immune system recovery, known as immune reconstitution, can actually take much longer, sometimes up to 6 months for an autologous transplant and even 1 to 2 years for an allogeneic transplant. This extended period is why transplant recipients are often given specific instructions and medications to prevent infections and graft versus host disease during their long-term recovery. Understanding these recovery phases, from the initial 2 to 4 week engraftment to the longer journey of immune reconstitution, empowers you to partner with your medical team. By recognizing these milestones, you can better manage expectations, adhere to your post-transplant care plan, and actively participate in restoring your health and vitality after a stem cell transplant.